Why has industry failed in its quest to cure Alzheimer's disease? The best way to answer this is that it all depends on how you phrase the question. Industry has been incredibly successful. The technology that we have available to us today pretty well enables us to address and solve virtually any biochemical problem we can envision. So in terms of whether they succeeded or failed, really depends on how you ask the question. They posed a question that said that beta amyloid is the causal feature of Alzheimer's disease. They made that determination. And then they set out to develop tools, technologies, and drugs that could block the formation of beta amyloid and also increase the clearance of beta amyloid. And in that fashion, they were incredibly successful. We have very powerful imaging technologies that can measure the amyloid in your brain, PET scan technology. We have antibodies that will clear beta amyloid from your brain. We have enzyme inhibitors, both beta secretase and gamma secretase inhibitors, that can block the formation of beta amyloid in the brain. So industry has been incredibly successful at targeting beta amyloid. Where industry has failed is in not asking the right questions. And they failed in taking a biomarker as being literally causal when the neuropathological and the behavioral information suggested otherwise. So the failure in industry was to place all their effort on beta amyloid, despite the fact that there was very little likelihood that beta amyloid removal would have any effect. And this is a common problem in industry where we get a biomarker and we confuse the biomarker as a causal agent for a disease, rather than saying the biomarker is an indicator of an underlying causation of a disease. So in this situation, beta amyloid is a very valuable biomarker of abnormal membrane function. In order for beta amyloid to occur in the human brain, it means that the natural balance of the alpha secretase versus beta secretase enzyme has been disrupted, which means more amyloid precursor protein is being processed by beta secretase than normally would, and or less of that protein is being processed by alpha secretase. So beta amyloid as a biomarker is a valid biomarker, but it is a biomarker of abnormal membrane function. Industry failed in assuming that the beta amyloid was actually a toxic agent, that the elevation of beta amyloid was causing neuronal degeneration, despite much evidence to the contrary. We have many examples of neuropathology where you have very healthy brain function with massive loads of amyloid. So amyloid is not, obviously amyloid is not good. So clearly that's not I'm not arguing that good, beta amyloid in your brain is a healthy thing. But beta amyloid, the evidence that it's actually a toxically active agent in the human brain is very low. And that's where industry failed on the beta amyloid hypothesis.